Hi, my name is Jessica, and I'm going to talk about what are the implications of age in development and why does this matter to social work. Firstly, social workers must provide thorough assessments and intervention strategies. So in order to do this intervention, a social worker must first evaluate all the contributing factors that influence functioning. Many factors must be evaluated to understand the cause of problems. Areas such as biological, psychological, and environmental issues all contribute to the functions of a social worker, and must evaluate also the stages of development to assess how age can influence behavior. Age provides a context in which behaviors occur. For instance, newborn babies aren't expected to be able to roll over right away. That's normal, but if a 2-year-old isn't able to roll over, then that's probably indicative of a severe disability. Developmental differences in children can also make a difference in their ability to cope with change. For instance, military children often have trouble coping with a parent being deployed and having to deal with the absence for that period of time. Children ages 3 to 5 have the most problems coping. They're not able to utilize their abstract thought, and they're limited in knowing what kinds of questions to ask. They feel anxious and confused, and they rely a lot on their parents for emotional support. However, older children have an easier time coping. They begin to rely more on their school and peer interactions, and they're able to cope a little bit better. Therefore, age is an important element to consider when evaluating the context of behavior. In assessing whether or not behavior falls within the normal spectrum of development is essential in determining if developmental delays are present. It is important to recognize the existence of developmental problems as early as possible so that intervention can be made to reduce the negative effects resulting from developmental problems. In order to better identify developmental problems, development assessment tools can be used. The Ages and Stages questionnaire, for instance, is a good starting point. However, this developmental assessment tool must be coupled with information in regards to cultural norms and to use the biopsychosocial to understand the full context of the problems. Let's talk about the Southwest for a minute. There is a diverse demographic in the Southwest. It's predominantly white, but there also includes Hispanics, African Americans, Native Americans, and Asian populations. The Ages and Stages and other developmental assessments are based on the majority of children in the country, which is currently white children. When comparing these norms to minorities, minority children can appear to be abnormal. For example, African Americans appear advanced in some areas, and Native Americans and Asians appear reserved in other ways. The way that children are parented by different minorities makes a huge difference. For instance, African Americans tend to keep their babies in upright positions throughout the day and encourage the babies to stand and to sit and to walk early. Conversely, Asian Americans and Native Americans are more protective and slower to encourage these types of behaviors. These are examples of how culture can affect perceived developmental norms. What I learned from this experience? I learned the importance of context. Age and development influence thought processes and the ability to understand and cope with experiences. I learned that not only is age important and development important to assess, but that it must be viewed within the context of culture and the greater environment. The more information a social worker can glean from an assessment, the more beneficial the intervention will be. Thank you so much for taking time to listen to my video. I look forward to listening to yours. Thank you and have a good day.